Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and rare case documented in the Journal of the American Animal Hospital Association, a surgical success story involving a Chihuahua with a traumatic brain herniation. This is the first reported case of this type of injury and its surgical management. Our story begins with a 1-year-old female Chihuahua, weighing just 2.4 kilograms, who was brought in for a traumatic skull injury. The little dog had been attacked by another dog 2 days prior, resulting in a noticeable swelling on her skull. Upon physical examination, it was evident that there was a mass effect on the dorsal aspect of the skull, though there was no open wound. The dog's heart rate was 136 beats per minute, with normal respiratory rate and temperature. Her systolic blood pressure measured 140 millimeters of mercury. Neurological examination revealed slightly depressed mentation, but no cranial nerve deficits, and she was able to walk with normal spinal reflexes. Her modified Glasgow Coma score was 18, and initial blood work came back within normal limits. To get a clearer picture of what was happening beneath the skin, a computed tomography scan of the head and cervical region was performed under general anesthesia. The images revealed a single, sharply defined fontanelle, a gap between the skull bones normally closed in most breeds, at the junction of the frontal and parietal bones. In this Chihuahua, the fontanelle, specifically the Bregmatic fontanelle, persisted, measuring 1.2 centimeters in length and 1.1 centimeters in width. The scan showed no traumatic bone fracture associated with this congenital defect. At the site of the open fontanelle, there was a focal swelling deforming the surface of the skin. Further investigation with contrast injection revealed a continuity, based on blood vessels, between the right parietal lobe and the subcutaneous swelling through the open fontanelle. This confirmed a transcalvarial brain herniation, where brain tissue was protruding through the skull defect. The shape of the herniated brain gave it a mushroom cap appearance, due to the mild constriction as it passed through the opening. The brain parenchyma within the hernia appeared different compared to the normal brain tissue. There was also a poorly defined area and a slight shift in the midline of the brain, indicating vasogenic edema and mild caudal transtentorial and cerebellar herniation. These findings suggested intracranial hypertension, though the possibility of a congenital origin could not be ruled out. The dog also had subcutaneous swelling of the face, especially at the frontal bone, indicating subcutaneous edema. The Chihuahua also presented with multiple congenital anomalies including aplasia of frontal sinuses, domed skull, occipital dysplasia, a partial empty sella, and moderate dilation of the ventricular system. Faced with this complex situation, the veterinary team elected for surgical intervention. The dog was positioned on her chest with her head elevated. An incision was made over the hernia, and the subcutaneous tissue was carefully separated from the skull. The brain hernia was identified, but the membrane usually covering the fontanelle was not clearly visible. The brain tissue at the site was edematous and had an associated hematoma. The veterinary team carefully reduced the hernia by applying gentle pressure with a periosteal elevator. To stabilize the area, an absorbable hemostat was placed at the level of the defect. A pre-cut hexagonal piece of polypropylene mesh was used to cover the defect and was secured to the fascia of the temporalis muscle using sutures. The subcutaneous layer and skin were then closed in multiple layers, and a tie-over bandage was applied to protect the surgical wound. The dog recovered from anesthesia without complications. Postoperative care included pain management, intravenous fluids, and antibiotics. A follow-up neurological examination the day after surgery was unremarkable. The dog was discharged 2 days after the procedure, with a prescription of prednisolone for 5 days and amoxicillin clavulanic acid for 10 days. The tie-over bandage was removed a week after surgery. At a 6-week follow-up, there were no complications or concerns. 6 months after the surgery, the owner reported that the dog continued to be neurologically normal. This case is particularly interesting because brain herniation can occur in different forms, including subfalcine, rostral transtentorial, caudal transtentorial, at the foramen magnum, and transcalvarial. In this case, the herniation was transcalvarial, occurring through a skull defect, specifically the Bregmatic fontanelle. The rupture of the membrane at the fontanelle allowed the edematous brain to escape through the path of least resistance. Typically, brain herniation presents with altered consciousness, changes in pupil size and responsiveness, and altered cardiorespiratory patterns. However, in this case, only slightly depressed mentation was observed. Several factors may explain the subtle clinical signs. the small volume of herniated brain tissue, the location of the hernia involving the parietal lobe, primarily responsible for sensory input, and the possibility that the hernia attenuated the increase in intracranial pressure, preventing further complications. The dog's modified Glasgow Coma score of 18 on presentation indicated a good prognosis. Surgical management was essential to prevent further brain damage, as the presence of cerebral parenchyma beneath the skin can lead to compression of cortical veins, venous infarction, and contusion of the brain. Although widening the defect is sometimes necessary in this case, the reduction was relatively straightforward. It's worth noting that Chihuahuas are known for the frequent presence of a persistent Bregmatic Fontanelle, which is usually clinically irrelevant. Studies have shown that a high percentage of Chihuahuas have one or more persistent fontanelles. Various surgical materials can be used for skull defect reconstruction, including bone grafts, allografts, acrylic cranioplasty, and metallic mesh. In this case, a polypropylene mesh was chosen because the veterinary team determined that an extremely rigid material was not necessary. The relatively large size of the mesh made it easier to secure to the temporalis muscle. Computed tomography is a valuable tool for evaluating patients with traumatic brain injury, allowing for assessment of bony structures and acute hemorrhage. While magnetic resonance imaging can provide a better assessment of the brain parenchyma, computed tomography is faster, which is advantageous for neurologically compromised or unstable patients. It is also worth mentioning that Chihuahuas have been described as having an above-average aggression score toward humans and other dogs. This breed tendency, combined with the delayed closure of the Bregmatic Fontanelle, may explain why this particular type of herniation occurred in this patient. In conclusion, this case report highlights the importance of considering brain herniation in small breed dogs with persistent fontanelles, even in the absence of skull fractures. It demonstrates the successful use of advanced imaging and surgical management in a rare and complex case. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.